All right, welcome back. Hope you're having a great week. Today we're continuing our review of our third practice exam, where we're going through the next set of 10 questions and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for this exam plus our other two, please check out bcbastudy.com. We also offer our 5th edition task list study guide and our combo pack, which includes flashcards. It's our best deal. When you pass your exam, let us know so we can include you in our Sunday shout out. As always, work hard, study hard. Let's get to our questions. Question 1, which of the following behavior goals would be the most inappropriate to use in a treatment plan? When we're selecting goals, we're looking for things that are socially valid, that have meaning, and that are going to improve the lives of the client and those around them. We also want to choose behaviors that we can observe and measure. Remember, we deal in operant public events. We don't want to work with private events. We don't want to work with mentalisms. We can't observe those accurately, validly, and reliably. In this case, when you're talking about behavior goals that are going to be inappropriate, typically the answer is going to be something that's either subjective, that's unobservable, or maybe it involves a mentalism. If all four don't fit those criteria, then you're going to look for the least socially valid one. Let that guide us when we choose our answer here. Remember, we're looking for the most inappropriate to use in a treatment plan. A, the client will hold a pencil using a proper grip and trace his name. Can you observe the client holding a pencil with a proper grip and tracing his name? Sure. All we need to do is define proper grip, and we can easily observe and measure this. So there's a little subjectivity with proper grip, but as long as we're identifying this, we can easily observe them writing and tracing their name. Of course, this is socially valid because the client will eventually need to know how to write their name. B, the client will remain calm when asked to hold a pencil and trace his name. What's wrong here? Well, the issue is this word calm. When we're dealing with things like calmness and frustration and anger and anxiety, we're talking about these private events, these mentalisms, okay, that sure constitute a state of being, but not one we can reliably measure. Remember, we're looking for accuracy, validity, and reliability. It's hard to do that with a word like calm, which means a bunch of different things depending on who you talk to. It's going to be very hard to operationally define this idea of calm. B is just way worse than A. What about C? The client will trace at least 6 letters without prompts when asked to trace his name. Observable, measurable, socially valid. Looks good. D, the client will write his name without prompts at the top of his worksheet. Again, observable, measurable, socially valid, dealing in public operant events. Nothing wrong there. Clearly, the most inappropriate one would be this idea of having the client remain calm, so to speak, when asked to hold a pencil and trace his name. It's the least objective, it's the least observable, the least measurable. B is our answer. You are a BCBA who works for a private ABA company. An adult home reaches out to you and asks if you would provide consultation as a private contractor. You agree, but when you arrive, you notice there are certain things occurring that you feel are unethical in regards to the clients. What should you do? A couple things to consider here. One, it's an ethics question. It involves third-party contractors, which is part of our ethical code. And we have to remember, we as behavior analysts abide by the ethical code no matter who we're working for. We always put the client's interests first, and we have to remember outside services, outside businesses and contractors don't abide by our same code. We have to keep that in mind. In this case, the question wants to know, what should we do? So again, let's not jump to the answer choices. Let's reevaluate our question. We're working for a private ABA company, but we're being contracted out. So when you arrive, you notice there are certain things occurring that are unethical in regards to the clients. So based on what we just said, what are we going to do? A, respect the adult home's right to run their business as they please. The adult home has that right, but it doesn't mean it's okay. Now, we can't go ahead and report them to the board because they don't abide by our ethical standards. They abide by the law and they abide by human rights standards, but not by our standards. So while we can't tell them what to do, we can't just sit there and do nothing. B, report the adult home to the BACB. Again, the problem here is they don't abide by our code. The BACB can't do anything to this private contractor unless they're specifically an ABA company, right? Which we're not sure. It's an adult home, okay? C, request that the group home correct the ethical concerns or withdraw your consultation services. Yes, We approach the owner or the supervisor, point out our concerns, give them a chance to respond. If they respond, great. Let's continue improving the lives of these adults. Or if they balk or deny it or don't change, we need to withdraw our consultation services. We should not be providing services in this unethical environment where we can possibly inflict harm on a client. And then D, terminate your contract immediately. You do have that right, but why not first try to correct the wrongs you notice, right? Let's go first and say, this is what's going on. It's unethical. Here's how we can fix it. Give them the chance to fix it, because remember, we're always looking out for the client's best interest first. So what should we do? What is the best answer? It's going to be C. Request that the group home correct the ethical concerns or withdraw your consultation services. People who pass the BCBA exam get really good at understanding why the best answer is the best answer, and the answers that look okay aren't better, right? So we need to get better at identifying the best answer and understand why the ones like terminate your contract immediately aren't better than C. Hussein is training a student on the 100-yard dash. As a warm-up, he asks the student to do 20 jumping jacks and 25 burpees, which takes 5 minutes. The student then walks to the starting line. Hussein yells go, and the student completes the sprint in 11 seconds. 3 minutes later, Hussein yells go again, and the student starts running. What represents inter-response time in this scenario? You might see measurement questions like this on the exam. Basic measurement at this point should be very easy if you're taking the BCBA exam. So they're going to try to throw in a lot of variables to try to confuse you and trip you up. The best way to do this is identify each measurement and its relation to the question. So first, we know student on the 100-yard dash. Well, we're measuring, let's say, duration. Okay, it's 100 yards length. As a warm-up, he asks the student to do 20 jumping jacks, 25 burpees, frequency, which takes 5 minutes, duration. The student then walks to the starting line. Hussein yells go, and the student completes the sprint in 11 seconds, duration. 3 minutes later, Hussein yells go again. All right. Now, 3 minutes represents what? It represents the time between Hussein yelling go and Hussein yelling go again. Time in between behaviors would be the response time. Our answer is going to be what? 3 minutes. Don't make these questions harder than they are, right? Systematically go through each one. Don't rush through it and get to the answer choices. Figure it out up front in the question stem. Once you do that, measurement questions, reinforcement, punishment questions, all these behavioral questions are going to become much, much simpler. 4, which of the following is an example of imitation? The exam wants you to know the true definition of imitation. We have modeling, we have imitation. And the true definition of imitation is a behavior evoked by a non-verbal stimulus that occurs immediately after that stimulus, right? Meaning somebody telling you to do 10 push-ups and then you doing 10 push-ups the next day. 1, it's a verbal SD. 2, it's not immediate. So we're looking for an example of a non-verbal SD and a behavior that happens immediately after that non-verbal SD. A, Borat says high five and is given a high five. Well, saying high five is verbal SD, not imitation. Yesterday, you watched a video of someone doing a backflip off a diving board. All right, nonverbal SD. However, today you attempt the same backflip off the diving board. Several hours have passed since watching that video, not imitation. You see your friend chug a beer, so you chug a beer right after. Okay, nonverbal SD, chugging a beer. Right after you chug the beer, this is imitation, much more so than both A and B. C, a detour sign redirects traffic down another road. The sign is simply an SD, pushing the traffic elsewhere. There's no imitation. We're not copying the cars. We are going by the sign, the SD on the sign. Nonverbal SD, friend chug a beer. You chug a beer right after. Immediacy. Following an example of imitation. C, you see your friend chug a beer right after. You and your friends visit Napa Valley and tour several wineries. At each winery, you're given a list of several different wines. In order to identify the wine you want, you would need to know how to what? Easy question. Don't overthink it. What is happening? Well, you're touring wineries. At each winery, you're giving a list of several different wines, and you want to identify the wine you want. Meaning you're basically reading a menu, right? You have a Cabernet, a Merlot, and a Riesling, and you want to choose which one you want. Well, in order to tell the difference between the different stimuli, what skill do we need? We don't need echo. We're not copying anyone's verbal statement. We don't need to transcribe anything. We're not writing anything down. So we're either going to discriminate or differentiate. Now remember, discrimination is technically stimulus discrimination. Differentiation is response differentiation. So are we differentiating between responses here? Well, no, we're just picking, which is one response. We're discriminating between stimuli, the different wines. So in order to choose the wine you want, you need to be able to discriminate between the different types. I find it easiest to remember. Discrimination is actually called stimulus discrimination. Differentiation is actually called response differentiation. That's going to remind you when you're dealing with discrimination, you're dealing with stimuli. When you're dealing with differentiation, you're dealing with responses. In this case, we're dealing with stimuli, the different types of wine. Therefore, we need to discriminate. Of the following behaviors, what would be the least desirable to target using a changing criterion design? Now, this goes back to our task list where we need to know experimental designs, single subject designs. You need to know when the right time to use a design is and when the wrong time is. Designs are good for some things, not so good at other things. The main thing a changing criterion design is not good for is teaching a new behavior. Changing criterion design should be used for behaviors already in the client's repertoire. Remember this fact, okay? So A, eating less sugary foods throughout the week. Well, we can certainly use a changing criterion design as the criterion lowers for the amount of sugary foods eaten throughout the week. Behaviors already in the repertoire, no problem. Increasing the amount of pages of a book you read each night. Sure, I can start at baseline with maybe 5, change the criterion to 10, 15, etc. Reading is already in your repertoire. All good. Learning how to throw a ball. Learning, okay, that's the key word here. We can't teach someone to throw a ball using the changing criterion design. That's not the purpose of the design. We're trying to increase or decrease a behavior already exists. Let's say we can throw a ball, and now we want to increase our distance. There's something, or throw it harder. There's something. Behavior's already in the repertoire. You can modify it. We're not teaching using the criterion design. And then D, decreasing the amount of mistakes made on a writing assignment. Sure, we're writing. You're allowed 15 mistakes, then 10, then 5, etc. So of the following behaviors, what would be the least desirable to target using a changing criterion design? C, learning how to throw a ball. A college professor wants to raise attendance in her class. She starts providing pre-class non-contingent reinforcement and post-class reinforcement for those who attend class. If you wanted to evaluate the effectiveness of each type of reinforcement, she would do what? Comparative analysis, component analysis, parametric analysis. All different things, all exist in the same ballpark. Understand the difference. You are almost undoubtedly going to be asked about at least one of these. What is a comparative analysis? Comparative analysis is comparing treatments or interventions that aren't part of a package. A component analysis is comparing treatment interventions that are part of a package. Is the college professor implementing a package? She is. Her intervention package consists of pre-class non-contingent reinforcement and post-class reinforcement. She needs to compare the effectiveness of each intervention in her package. Parametric analysis is going to determine how much of an intervention. So a parametric analysis looks at a single intervention and determines the amount. It's a dosage. How much medicine do we need to take? How much reinforcement do we need to use? If we determine post-class reinforcement is the maintaining intervention, we can do a parametric analysis to determine, well, how much reinforcement exactly do they need? Understand the difference between the comparative, component, parametric analysis. It's going to help you. In this case, we have a package. We want to compare the interventions in each. We will conduct a component analysis. You dated a girl for 7 months, but it just did not work out. You ended on good terms, and now she wants you to supervise her. what do you need to do in order to provide supervision? The key here is you dated this girl. Stipulations for friendships are clear in ethics. Sexual relationships, dating, that's different. All right. So you dated this girl for 7 months, didn't work out, broke up, and you're on good terms, but now she wants you to supervise her. What do we need to do? A, you're not allowed to ever supervise her due to the past relationship. That's just incorrect. The BACB lays out stipulations for dating previous clients, being friends with previous clients, supervising previous relationships. They're all in the ethics code. Okay. You are allowed under a certain stipulation. B, you must wait 30 days after the relationship is over in order to provide supervision. Was it 30 days or is it 6 months? Because we know it's not D. Inform the BACB of your intent to provide supervision and begin supervising her. They're not really concerned unless you're violating the ethical code. Is it 30 days or is it 6 months? Well, they stipulate 6 months. You got to wait 6 months after it's over in order to provide supervision. They want to eliminate or reduce the risk of a conflict of interest. That's why you need to know your ethical code. Some of these things you can't brute force and figure out. You just have to know the facts. The facts are you must wait 6 months before you can provide supervision. During your initial record review, you notice that the client used to hit his head with his fist. This behavior was determined to be associated with migraines. Recently, the client has started to slap his head in the presence of you and the RBT. What should you do first in this situation? The behavior question, it's an ethics question disguised the behavior question. So don't jump to your assessments and everything. Read this question. What does it say? Well, you do a record review, which is great, and you see the client used to hit his head with his fist. You then see it was associated with migraines. Is migraines a private or public event? It's going to be private. We can't observe these migraines. Okay. It's also a medical situation. So if we know this history on the client, and all of a sudden the client starts to slap his head in the presence of you and the RBT, what do we need to do first? A, conduct a functional analysis on the slapping behavior. All right, I would probably do this after my assessment and after doing something else. Okay, functional analysis is definitely not what we're doing first. B, get in touch with the previous BCBA on the case and consult on the self-injurious behavior. You could certainly do that, but we already have the records. We already know it used to be associated with migraines. They might give you input, but you kind of have all the input you need. So given the facts, you would contact a medical professional as soon as possible. It's our duty, it's our obligation. Eliminate any medical reason before implementing behavior procedures. And then D, complete a continuing education program on self-injury and migraines. Probably not a bad idea to complete CEs on things relevant to your practice. However, before we do any sort of assessment, consultations, or CEs, we need to rule out it's just not migraines again. If it's migraines, maybe they have medicine and we don't even have to intervene. Our obligation to contact a medical professional as soon as possible. Behavior typically persists or ceases to exist due to one of 3 causes: phylogenetically, ontogenically, or culturally. Another way to describe these causes is what? All right. Phylogenetically indicates, let's say, natural selection, where you are genetically predisposed to reproduce, and the behaviors that keep us alive or help us prosper continue on down the line. That's all genetics. It's natural selection, right? Ontogenically is much more in a vacuum of learning history, individual to individual. Okay, much more environmental. Culturally is more, they consider it spoken or taught behaviors passed down from generation to generation. Okay, the semantics aren't necessarily the point here. Okay, they want to know which one of these, okay, are we describing when we talk about phylogenetic, ontogenic, and cultural? Are we describing parsimony? Well, parsimony says the simplest explanation is the one we use first. Not talking about simplest explanations, can't be it. Selectionism. Selectionism says behavior is chosen either genetically, through learning history, or through culture. Selectionism is it is, right? What about pragmatism? Pragmatism says we do the right thing based on what the outcome is. Does it work? Does it not work? That's what we're concerned with. When we're pragmatic, Okay, what works, what doesn't work? Let's do what works. That's how we evaluate treatment. What works, what doesn't work. And then empiricism involves actual observation of the behavior that we are trying to change. Not talking about that. We're talking about the 3 causes of behavior being chosen, or in other words, selected. So another way to describe these causes is selectionism. All right, thanks for watching. We'll be back with our next part in this series. Remember, if you want this exam plus our other 2, check out bcbastudy.com. Also, the task list study guide and the combo pack. Questions, comments, let us know. Work hard, study hard. See you soon.